All right, are we live? Let's see here. How's everyone doing? Let me just get all situated here. All right, Chris says we're live. Can everyone see me and hear me very well? If so, how about let's get like a hello on the chat really quick. If you all can hear me and see me very well. And I'm gonna move my laptop a little closer. All right. All right, so we got Chris here. And... All right, so sorry it took me a while to kind of get on here, but my name is Aaron. I guess I'll just do some formalities. I'm a doctor of physical therapy. I'm located and based out here in San Diego. Anybody here from the West Coast? Anybody here from San Diego? Or if you're not from San Diego, let's see where everyone else is at, and just message on the chat where you're from. Working. So again, just to continue to introduce myself, my name is Aaron Galutera. I am a doctor of physical therapy. I also do some recovery visits here in San Diego, working with a lot of powerlifters, CrossFit athletes, high school and collegiate athletes. Dallas, hello from Dallas, Miami, Florida. All great places to be at right now. It's hard to see the weather, but it's actually gloomy out here in San Diego. But yeah, so I am a doctor of physical therapy. I do strength and mobility coaching, both in person and online. And I am pending my Animal Flow Level 1 in strength. I don't know if anyone here is familiar with Animal Flow, but it's a very strength and mobility based exercise. So today we're gonna go over this wonderful product by Mobility Wall. So they're attached to my wall. So if you do have the and you are joining us, make sure you get secure. We're gonna start here very shortly. We are also doing a travel bag giveaway. So with that being said, how you can get the opportunity to win that travel bag is just be very active in the chat. Hello, Addison from Philadelphia. Be active in the chat. Ask any questions that you may have. If there's some things that you need me to break down a little bit more, or if there is a certain exercise or body part that you want me to go over, just be very active in the chat, and that will help you win this free travel bag given by Mobility Wall. So I'll probably give like another 1 to 2 minutes for people to come in and tune in, and then we'll get started very shortly. I guess before I start, I kind of want to get a general idea of everyone's fitness, exercise background, just so it can help tailor fit what muscles and areas that I want to target for this live coaching session. So if you all can put it on the chat, whether or not you are a runner, whether or not you're a weekend warrior, like you work a 9 to 5 throughout the week and you try to get your exercises in on the weekend. If you are, involved with powerlifting, whether recreational or competitive or CrossFit, um, or yoga, just type in the chat. That way I kind of get an idea of the room and what kind of fitness and exercise that we are all involved in. So I guess I'll start with myself while everyone else is putting theirs. But I do mainly recreational powerlifting, so squat, deadlift, bench press, a lot of functional fitness. I do CrossFit type movements every now and then, but I do work a lot with CrossFitters and powerlifters. And then, like I said before, I also do animal flow type exercises. So a lot of ground based calisthenics. And then let me just get an idea of everyone else's fitness and exercise background, and we'll get started here. Got a lot of questions about preferences around using mobility wall pre and post workout for recovery. So that's a really great question, Chris. So you can use mobility wall for before or after your workout. Um, for tissue prep, you can definitely use the mobility wall, and I'll break it down, the differences between the mobility wall and a foam roller, but this will get the job done quicker and more effective. But I do use the mobility wall a lot post workout. One, because most of the time it's in my room. So after a lot of my training days, I just get on here, work out my traps, work out my T spine, my hip flexors, my quads. But you're more than welcome to use this before your workout as well. Hard for me because my gym is in my garage and my door doesn't always stay open. So it closes on the mobility wall. So it's not as effective. um, and if you want to bring a mobility wall to the gym or just get on it before you head to the gym would be good as well. Timothy, regular fitness, full body weight training, cycling, and now mobility wall to stretch and massage. Awesome. Yep. So, kind of like Tim said, mobility wall isn't supposed to replace your fitness, but it is supposed to be used as an adjunct to kind of improve your performance, improve your recovery. So definitely helpful for like regular fitness, full body weight training, and cycling. Awesome. Thanks, Tim. All right. While everyone else is still typing in the chat, we're gonna get started. I'm gonna go from top to bottom of things that I've used the mobility for. One thing I do want to break down why I love this product so much is one, it's definitely a lot more easier. A lot more easier. That's not even good English. It's a lot easier than getting down on a foam roller. Uh, and the fact, I don't know if else has used mobility wall before, but instead of that downward pressure of laying on your foam roller, the mobility wall is more of an inward and upward pressure. So it's a lot more effective, a lot easier to get on. So the first one I want to go over is working the suboccipitals. So these are the muscles that we have kind of the base of our skull. Really good for those that work a 9 to 5, working at a desk, students, um, always in this kind of posture right here. So what I want us to do, let's see if this is a good angle. Yep. So what I want us to do is you're gonna place that foam roller right here first, kind of near like the bony part of your shoulder blade. You're gonna come up here and you're gonna do like a mini squat into the foam roller so that the mobility wall is gonna be hooked on the base of your skull. And then from here, sorry, maybe I should turn off my lights to see if that takes out the glare. There we go. Um, So you're gonna squat down into it so that the foam roller or that the mobility wall is kind of at the base of your skull and just hang out here. You start to feel that as you squat down and the mobility wall provides that upward pressure, right, as it hooks to that base of the skull, it'll give that little bit of suboccipital distraction. For here, I just want you to just hang out. This is really great for people who get a lot of tension headaches as well, just releasing those suboccipitals and you just hang out here. And then you can come back off, squat down into it again, let the mobility wall provide that upward pressure onto the base of that skull, relieving that suboccipitals. What you can also do here, and what I love to do, is as you sink into it, kind of rotate very subtle to the left and right. That way you can bias the left and right side. One thing that people will start to experience with this is kind of like that euphoria of um, just releasing a lot of tension at the base of the skull. Should be very relaxing. A lot of my clients love this when I do this hands-on to them, where I take my fingertips, place in the base of the skull, and just give a little suboccipital distraction. This is great because now I don't have to have anyone do it for me. Just get in the mobility wall. You're here, sink in, and then just let it traction you. So hang out here for about a minute or so. Any questions with this one? Any of you have any difficult kind of getting the effect of that suboccipital distraction at all? If you also work as a desk job or work at a desk or a student, um, leave a comment. That way I can see if this is effective for some people. Have already been using it? If so, what some of the areas you are trying to focus on? All right. So that's one. It's just for the suboccipitals. So usually I place the mobility wall, just to recap, I place the mobility wall right on the spine, the scap or that bony part of your shoulder blade. Squat down into it and then relax. Take some deep breaths. The next part I want to go over is releasing a lot of the upper trap scapular muscles up here. Really great for those that are involved in gymnastics, that are involved in CrossFit, do a lot of overhead exercises, or overhead athletes, football players like quarterbacks, baseball pitchers. These are great. So, what I wanted to do here is place that mobility wall right kind of near the tip of your shoulder, where that shoulder meets the shoulder blade. And then from here, a good position to put the mobility wall, if you're trying to set the proper height for it, is it should be in line with your shoulder. And all you do here is kind of sink downwards and get into the upper trap. And what I want us to do here is I just want us to scan. I just want you to go back and forth, left and just shifting your weight. All you're doing here is shifting your weight and then providing that inward and upward pressure towards the mobility. So I found my spot right here that I feel pretty, I found a tender spot and a trigger point. So from here, I'll just hold, relax, take some deep breaths, let it sink in a little bit. And then from here, we can work the upper trap a little bit. So what we're going to do here is attack and glide. So from here, provide the inward upward pressure. And then you're just going to rotate your chin towards your mobility wall. As you're providing the inward and upward pressure, and then come right back off. Scan again, try to find another spot or hang out and stay there. Turn your head, turn your chin towards the mobility wall. Try not to be so rounded. Like, don't round your shoulders, don't tilt your head forward. Try to stay nice and upright. Kind of get that chin tuck where your chin is up here towards you. And then you're turning, that way you get that upper trap stretch a little bit more. And you're just tacking and gliding that upper trap. And then you can go opposite, you can go chin to your chest. And this will bias more of your levator scap. And then sometimes I'll just go back and forth here. This one I do definitely post workout, especially chest and shoulder day. This is something I like to tackle. Got a lot of questions, preferences. We read that one. Tim, you work 10 plus hours a day. So this, you probably love the first two already. The suboccipital distraction and the upper trap levator scap tack and glide. Those will be really good for you. Do you put your mobility wall at all where you work, whether you're at the office or working from home? Because if so, that would be a great idea. Because I mean, I usually recommend my clients that work at a desk, like 10 plus, 8 to 10 plus hours a day, to one, stretch, mobilize. But if you have the mobility wall accessible to you, definitely get on that. Um, Not yet. Yeah, Natalie. I mean, I hope that this live session will kind of give a little breakdown of how effective the mobility wall is. And I'll be going over some upper back areas, upper back, neck, and spine. So definitely we'll tackle those. Yeah, Chris, I agree. I hope the mobility wall is set up in Tim's office as well. And we'll definitely go over. So we went over upper trap, suboccipitals, and also that rounded shoulder. So we'll work on mobilizing that pec as well during this session. Victoria from Colombia, welcome, welcome. All right. So, so we went over suboccipitals. We went over upper trap, levator scap, all of that, those anterior and posterior neck muscles right here. the shoulder girdle. One thing I also want to go tackle is the pec. So I have the Pro series. So I do have. I don't know if if the original version also has the attachment to it. Chris, if you can break that down. But this is what I love to do to kind of just help release, the anterior shoulder girdle and the pec. Um, is getting this attachment really easy, really simple. Like I said, this product does it. It's so simple yet so effective. Um, and I would actually lower this because I am not that tall. So I would lower this so that the attachment device is in line with my shoulder girdle, or at least my anterior shoulder. All right, lock this in. So I am placing the attachment. It's a little bit bigger than this one right here. First, I'll probably scan around, try to get different aspects of the anterior shoulder girdle. I'll go here, and again, I am just providing that inward pressure. I'll scan a little bit, like I'll pin, and I like to really get that overpressure. So I'll lower it down so you can see my stance. So I kind of put myself in like a staggered stance here so that I can kind of push off of my back leg to get that extra bit of pressure. So you'll see me doing that a lot throughout the session, is finding ways that I can provide extra overpressure. But I'm up here, and then sometimes I'll just if I'm just trying to scan, I'll relax my hand on the mobility wall so that my pec, my anterior shoulder girdle muscles um, aren't active. That way I can really get that muscle to release. And then from here, then I can add some active. You can do some wall slides, like slide up the wall or like crawl up the wall to do a little tack and glide. You can also open it up or you can close it down. I'll just get this area and I'll just work through it a little bit. But I love this for um, for releasing that anterior shoulder. Really great, like I said, for those that work from home or that or college and high school students that spend hours of studying. This is a great way to kind of just release release those pectoral muscles that tend to really pull us into that rounded shoulder or forward shoulder position. It'll just help just open up that area, and of course, just adding some posterior chain strengthening to kind of help further open up that shoulder girdle. Let me just catch up here. Love the sessions. Yeah, the sessions are good. I actually know um, the the coach from last week, Colin. He's a great guy too. So mobility wall smooth roller comes in with both the ball and the attachment. Okay, so it looks like the smooth roller, which is the other version of the mobility wall, comes with the small ball attachment. So and then the one that I have, the Pro, comes with the big ball, this one, and these two. All right. Yeah. So using the leg, like Chris said, using the leg as a driver is really good to kind of help provide that overpressure, get that neuromuscular release, that nervous system to kind of relax a little bit more. I would need the Pro. Yeah. I mean, honestly, it's go big or go home, right, Natalie? Go big or go home, get the Pro version. Especially, this is what I usually tell my clients, and I would say this is a really great investment, is we are constantly investing in our health. Sometimes we'll spend money on other things. This is what I tell my clients too. If they want to really become better and improve their health and fitness lifestyle, you got to invest in the right things. And the mobility wall has definitely done that. All right, let me just read comments one more time, and then I'll go over foam rolling the lats a little bit and the importance of good lat mobility. The Pro is great. Exactly, yeah. Investing in our health is really good. Natalie, massage therapist and yogi. Yep, this will be really good for you. I mean, one, because I do a lot of manual therapy as well. So you know what to scan for and look for. So being able to use this will be really good. Um, Next area I do want to target. So we went over suboccipitals, upper trap, levator scap, pec muscle. I do want to go over kind of this muscle belly that we have here, the lats. Lats are super important for like our overhead mobility. Again, having adequate lat mobility is good, even just for daily tasks of reaching overhead. And also it comes with thoracic mobility, and we'll go over that later. But I love using the mobility wall for my clients that are CrossFitters, overhead athletes, just to kind of help release this. So release the lat muscle. When I meant this, I meant lat muscle. So I typically like to lower down the mobility wall. Mine's a little squeaky. Let me put some W40 on this. All right. And also, just a little tip, when you are setting this up, make sure you're on the side where the L brackets are facing towards the wall. Like my L brackets are facing this way. So I want to make sure I'm providing my inward and upward pressure towards that direction. Because if you go the opposite way, I mean, hopefully it doesn't happen, but I mean, it doesn't secure it as well as going the other way. All right. Trust me, this thing locks in pretty well, but I mean, it's just better for us to go towards where the L brackets are facing. But back to what we're going to work on is the lat. So here, again, I kind of like to go in a staggered stance just to give me a little bit of leverage. So I kind of go cross like this. My back leg, or the leg closest to mobility wall, is my back leg. And I am putting the mobility wall right on this muscle belly right here. And that's enough. I just want to show you guys my stance. But yeah, so the leg closest to the mobility wall is my back leg. And from here, I just want you to scan. Scan around, kind of sink into it, drive up. Remember the lat kind of it connects, well, it attaches scapula, shoulder, like the upper shoulder, and all the way to like your lumbar fascia. So it's this huge posterior chain muscle. And I just want you to scan. I just want you to drive, up and down, find a tender spot, place your arm on that mobility wall. That way you kind of put some slack on your lats. And for me, I found my tender spot. Two ways that I like to mobilize my lats with the mobility wall is pin, and then I like to kind of glide my muscle, that muscle belly back and forth. So I am driving forward and backwards so that my lats are now gliding over the mobility wall. With the Pro, it comes with these grooves that really help with the pin and with the tack and glide. So it really helps release that lat. And then I like to do a little bit more active too. So I'll place my elbow right on the mobility wall. Your lats are also an internal rotator. So sometimes from here, as I pin my lat into the mobility wall, I'll add some external and internal rotation so that now I am lengthening and shortening my lat onto the mobility wall. And I'm just pinning and gliding. So I'll just add some internal, some external rotation. You can go into some overhead mobility. So I'll place my hand behind my head. That way I can get some more stretch onto that lat, and then you can just foam roll back and forth. So, not foam roll. You can provide that inward and upward pressure onto that mobility wall. So helping improve that overhead mobility, and then just some pinning, stretching. Those are the ways that I like to use the mobility wall for lats. Really great, like I said, even for just a general population, but overhead athletes, just improving your overhead mobility. My CrossFitters, this is all great just to improve that overhead mobility. Let me just catch up on some comments here. Would you mind flipping your light back on? Yes, Amanda. Sorry about that. Is that better? Sorry, I wish it was a sunny San Diego type of day, but it's not, unfortunately. And I try to open the door to the bathroom too. See if I don't know if that made things any better. But there we go. But yeah, like I was saying, just reviewing, if you weren't able to see, I would pin and stretch, put the mobility wall right on this lat muscle belly. And then if I were to have the mobility wall right here, I would add some internal and external rotation, and then some overhead mobility too, to get that lat to relax. Ways to hit the IT band. I will go over that as I get to the lower extremity. I'm just working my way down, Vido man. So I'll go over my thoughts of foam rolling, or not foam rolling, of releasing the IT band, and areas that I like to target for that. Great tool for your clients. Yes, I agree with Chris. I think this would be a great tool for your clients, Natalie, as well. Tender spots all over, mainly my back. How much pressure should I put to start working on those spots? For me, what I usually tell my clients is, you know your body the most and what you can tolerate. If we're talking about pain scale wise, being from a 3 to a 5, discomfort or pain is good to work around, because then you're getting that relaxation. As you don't, you always want to work superficial to deep. So start with the superficial, take some deep breaths. That's why it's important to do that scan assessment. Let the mobility wall kind of sink into that superficial. As you start to, get that release, start to dig in deeper and deeper. All right, glad that the lighting's better, Amanda. All right, so that's the lats. One thing that I use the mobility wall too, because I used to do it for the foam roller, but the mobility wall makes it a lot easier, is using it as, and I'm not going to spend too much time on this, but using it as an active assisted mobility tool. So if I want to improve my overhead mobility, I'll just go over this really quickly. I do want to go over the lower quarter. How are we in time? 10:30. Okay. There are so many good ways that you can use the mobility wall. Like for me, if I want to improve, like if I just work my lats and I want to improve my overhead mobility, like if I'm doing my overhead squats or my snatches, I'm up here and I'm using that foam roller to kind of help me and assist me with that overhead mobility. And I'm just driving forward. I know it's not a myofascial release, but I mean, if you can find a tool that can do multiple jobs, the better. And this is why, like, investing on the right tools for your recovery and for your health and fitness is so important. Because for this, I mean, I used to do this with a foam roller, but laying down, stomach down, and working the overhead mobility. Here, I'm half kneeling, and this is so good for, like, I mean, it almost mimics an overhead squat unilaterally, because my hips and my knees are bent. So I'm here, overhead mobility, and I'm working that overhead flexion. So that's just another way that I've used the mobility walls, just help with some active mobility, just getting some active assisted. I'll work my way down. Let's target. Let me go over the lumbar spine. I feel like everyone's pretty familiar with thoracic extension. That's like the common one you would see in a foam roller. Pretty much the same thing that you would do with a mobility wall, just a lot simpler. If I have time towards the end, I'll go over it, but I want to make sure I go through the lower quarter in this session too. So I guess we'll go over Vido's comment. I'll start heading towards the hips a little bit. Let's start with the hamstrings, because one thing that I want to discuss here is, can the IT band be stretched? And a lot of research out there. It's hard to make actual lasting change in the IT band. I know we call it soft tissue, but all of our muscles are anything but soft. Especially the IT band. It's a strong fascia. Um, it's a strong soft tissue, actually just tissue in general. So for us to make lasting change of that IT band is not going to do as much. So I usually recommend my clients to not dig into the IT band because that usually causes more inflammation. My recommendation is to release the muscles that attach to the IT band. So the glutes, the lateral quads, the lateral hamstrings, that will help just open up and decrease some inflammation for that IT band. So let's go over, I guess I'll go over like hamstrings first. If you have any questions about why I think that with the IT band, leave a comment, and I'm more than welcome to touch base on that as well. But let's go over hamstring video. I hope that helps out a little bit. Uh, you know, I recommend from a physical therapy perspective, if you're having like IT band syndrome type symptoms, work on the muscles around it, and then work on some strengthening to help decrease that inflammation on the IT band or the irritation. Sorry. So as I tackle hamstring, I like to set up my mobility wall kind of. Let me just make sure this is set and secure. I like to set my mobility wall mid thigh. Huh, I wish I was that tall. Lower it down just a little bit. So I'm here. The further you put your back leg or the leg that you want to work on behind the mobility wall, the more drive you're gonna get. So if I'm working my right hamstring, my foot is maybe about more or less a foot behind the mobility wall, and my foot is plantar flex. So I'm here, and then from here, what I'm doing, if the mobility, I'm just gonna show you because I don't have any other angle in this hallway, but I'm gonna drive so that my heel is gonna go towards the ground. So I'm here. I'm in a staggered stance. If it's hard for you to kind of keep your balance, feel free. I mean, I have hand railings and a wall here. Feel free to hold on to a chair. But you're here, and I'm just driving down so that my heel is going towards the floor. And again, I'm providing that inward and upward pressure onto the mobility wall. For this, I usually start with scanning, and then just to touch base on I think it was Tim. If you have a painful spot like superficial, just work on releasing the superficial muscles and the superficial tissues first. There's no point of digging deeper and deeper and deeper if all the superficial muscles are still one overly active or two inflamed. So you want to work on that superficial tissues first, kind of let it relax, let it release, breathe through it, and then just continue to sink in. So for me, I found my spot here. I'm probably closer to my ischial 2, meaning closer to my butt with a hamstring. Remember, hamstring is a 2-joint muscle. So it crosses the hip, crosses the knee. What I like to do here, and it was very similar to what I was doing with the lats, is I'll just shift left and right. So now I'm providing the inward and upward pressure, my hamstrings onto the mobility wall, and it's tacking it down, and I'm shifting left and right. So now my hamstring is just gliding underneath the mobility wall. So that's what I like to do for the hamstrings. You can turn a little bit so you get the lateral hamstring. So for Vido, for your comment, this is a good one to target because IT band runs along here, attaches to most of your lateral hip musculature. then becomes the IT band. So then I'm releasing that lateral hamstring, which is also along the IT band here. So I'm here, I'm driving. I can rotate um, towards the outside of my leg to get that lateral hamstring. And then you can do the opposite direction and get the medial hamstring. I have a different way that I like to target my medial hamstring, but in this position, really great to get the entire hamstring muscle belly. Um, the entire hamstring muscle belly, and also getting that lateral hamstring as well. All right. Next, I want to go over the adductor muscle group. Let me just catch up on some comments here. Good to know. Kyle, I'm hoping that you're talking about the IT band. Yeah, and it's common with runners too, who get a lot of pain here, but most of the time I mean, you're running. So all these soft tissues, hamstrings, adductors, glutes are all tight and inflamed because it's repetitive motion, repetitive movement when you're doing long distance running. And that's what really gets that IT band inflamed. Oh, I see you're talking about Chris's. Never mind. Let's see. Yeah, so Kyle, so I like I said, I do have that railing. So for you, if you don't have a railing or a wall to kind of support, grab a chair. Like if you have a chair with a backrest, you can place that here or in front of you, and you can kind of drive so that you have that support. That way, you're not doing like a balance technique or a balance exercise while you're doing some mobility wall work. Hopefully, that answers your question. All right. So I'm gonna go over the adductor muscle group. So I'll slide this down. And for those that don't have a mobility wall, um, the setup for this is really simple. I mean, it literally tells you how to extend it because some door frames are different widths, and also how to tie in it. So it's really simple, really easy to use. Like I said, if there's anything that you can invest in a product like this is definitely one of those tools that I would use for my recovery that I will definitely invest in, or that I invested in. All right. So for the adductors, you're working on, or I'm working on the leg that's um, on the side of the L frame. So not the inside leg, but the leg that I was starting out with. I don't know why I'm having a hard time explaining myself. But anyway, I'm working on this leg, and I'm providing that inward pressure. So the good thing here is if you're in a door frame, which majority of us are, you have the support already. Working on this leg, and then I'm gonna tilt my camera down just a tad bit. And I'm doing that drive again. Like I said, anything that will help provide that overpressure, for me, that's a great thing to have or to incorporate. I mean, but if you're just trying to scan and even just a superficial muscle just feel really inflamed, just feels really tight. I mean, just scan and just shift your weight back and forth. But for me, I'll show it the way with the drive. I'm here. I'm providing that inward pressure so that I'm going towards the wall. And then if I want to get deeper into it, I'll kind of go into like a mini squat and then provide that inward pressure onto the mobility wall. You can scan, you can just hang out here, let it just release on its own. Don't forget, take your deep breaths in between. Let it release, let it relax. And remember your adductor, at least the adductor magnus is a two joint muscle as well. Passes the hip, passes the knee. So you can even go as far as getting to your distal femur or your distal upper leg so that it gets close to the knee. What I like to target here is I like to work on all directions of my upper leg here. So here I'm mainly on the adductor muscle group, and then I'll kind of turn so that now I'm getting my medial quad. So I'm here. So I'm not necessarily getting the bulk of the quad, but I'm getting that portion of the medial quad. So I'll start on my adductors, I'll rotate, and then I'll get that medial quad. And again, I'm providing that drive. I'm pushing off of my feet like I'm doing like a little calf raise, so that I get that extra bit of overpressure. Scan around, provide the overpressure, work on the entire muscle belly, and then you can work your way into a staggered stance. So now the mobility wall is directly over the bulk of your quad. And again, staggered stance, providing that knee drive. Breathe through it. All right. So that's how I go over at least the hamstring group, muscle group, the adductors, um, and your medial quad. So, oh, and for uh, for Vito, you can also work on the for the IT band. You can also get the lateral quad with the mobility wall as well. I'll probably have this a little bit higher since I'm not going to staggered stance. But I would go for Vito, for anyone who wants to follow along. For for those who have discomfort, IT band, lateral leg. Um, you're going back into that like that curtsy lunge, like I did with the lats. You're placing it on the outside of your quad, and then you're just pushing off. And this will get that lateral quad. All right, so it's not directly on the IT band, but it's right in front of that IT band. All right. So any questions on the upper leg portion, hamstrings, quad, adductors? Really meant to stick mobility, better leverage. Yeah, if you have the stick mobility, that would be helpful as well for the to get that drive. I don't have one, but that is definitely one of the things I want to invest in as well. You can also take that working leg off the ground and throw in some ART. Correct. So what Chris was talking about, for those who are not familiar with ART. So you can do it either in that staggered stance that we had for the quad, or in this version. So if I'm working actually, I'll do it for the entire quad. I probably was late to that comment, but he was probably talking about when I was in this position. So I'm getting that quad. You can hold on. You're providing that drive onto the mobility wall. Do some ART. So it's not kind of, it is what I similar to what I was doing with the lats, where I'd provide that internal external rotation to now lengthen and shorten the lats over the mobility wall. Same similar concept that we're doing with the quads is we're tacking down your quad on the mobility wall, and then you're lengthening and shortening that quad muscle over the mobility wall. All right, how are we doing so far? I know we probably got about 15 minutes. I am gonna go over kind of like the lower leg, but if you have any questions in regards to like other areas you want me to target, feel free to do so. I do have um, some ways that I target spinal mobility with the mobility wall. Try to phase that in as well. But I do want to go over um, mobilizing the calf and and the peroneal muscle group, or the fibular muscle groups here, which is very common in runners. Since the topic of IT band was brought up, I will go over those. Loving all the techniques and descriptions. Thanks, Chris. Appreciate it. Glad it's helpful. Just giving a little twist to ways that you can use this great product. I'll go over the calf and the peroneal muscle group really quick. If we're going over calf, try to have your mobility wall where it's leveled kind of halfway through your lower leg. Again, similar to the hamstring, the further your foot is out, the more pressure you're gonna get. So for me, I'm about, let's say, maybe half a foot behind, and I'm here, and I'm starting off where my foot is slightly plantar flexed, and I'm going into a dorsiflex position. So I'm here, bringing my heels towards the ground, providing that upward pressure onto the mobility wall, and then coming back off, and then bringing it down, and coming back off. A lot easier than sitting down on the ground, putting the foam roller underneath your calf, and now you have to do like a little tricep dip or a scap depression to elevate so you get all of your body weight on the foam roll. This one's a lot easier to get the calf. Similar to the hamstrings and the lats I talked about earlier, you can be here, and then you can weight shift left and right. I have a handrail here, like Kyle said. I think it was Kyle that said it earlier. You can use your stick mobility for support or a chair. That way you have that balance, and you don't have to worry about other factors that can make your recovery not as effective. So I'm here, and I'm tacking down my calf onto the mobility wall, and I'm just gliding laterally, immediately, or left to right. All right. Questions so far? Yeah, so much better than foam rolling your calves on the ground. Any foam rolling for piriformis pain? Uh, that's a great question. Thanks for tuning in, Deborah. Also, I know you hear some physical therapists. It depends. Are you getting piriformis pain because of sciatica? Because if that's the case, foam rolling isn't going to be. I'm not foam rolling. Mobility wall might not be your number one option to treat your piriformis pain, but it can be used as an adjunct. But if we are just targeting lateral glute piriformis, two ways I'd like to go about this. If it's true, like piriformis syndrome, piriformis pain, you want to make sure you have adequate hip mobility, which is why I believe mobility wall would be a great adjunct, because it does help provide that ability to get more mobility in your hips. But you do not want to dig in too much, especially if it's piriformis pain with like sciatica symptoms, because we do not want to irritate that nerve any more than it is. But in this case, if I do want to get my lateral hip musculature or my piriformis, I would kind of go in a figure four, and I'm in a diagonal, so I'm not parallel with the mobility wall, and neither am I perpendicular to it. I'm kind of just in between. I go into like a partial figure four stretch. If balance is an issue, or if even just standing on the opposite leg is an issue, feel free to hold on to a railing, your stick mobility, or a chair. And then you're just rocking back and forth. Again, I'm providing that knee drive. So in this case, I'm out here. I'm basically doing like a partial squat. I'm going back and forth, and then I can get some rotation into it too. Also, what I like to do is adding some hip adduction and hip abduction, and some rotational aspects of the hip to get into to get the lateral hip musculature more. So I'm here. I can bring into a little bit of adduction. It'll stretch out that piriformis lateral hip musculature as I'm providing that inward pressure onto the mobility wall. So that's one way I like to target lateral hip musculature, piriformis. The other way too is getting into that staggered stance. And now that foam roller is right on the glute. So again, I'm neither parallel, I'm neither perpendicular, but I'm kind of in a diagonal staggered stance. The mobility wall is right on my lateral hip, and I'm again driving with that leg that I'm foam rolling, or not foam rolling, that leg that I'm on the mobility wall. And I'm just plantar flexing, kind of doing like a drive into the mobility wall. All right, Deborah. So hopefully that helps with targeting that lateral hip musculature, piriformis. The piriformis is a deep muscle. It is meant to be a stabilizer. So from that perspective, stabilizing and strengthening that those hips, I would recommend after getting on the mobility wall. I always like to incorporate something active after I do any form of soft tissue release or myofascial release. Will you hit the shins as well? Yeah, Kyle, I can do that really quick. Let me just go over these questions really quick. Amazing how just moving side to side and not rolling help. Oh, yeah, exactly. Thank you. I've been doing the stretches. Awesome, Deborah. The stretches are good. Always incorporate something to help load that tissue afterwards, whether it be strengthening or providing load to lengthen that muscle as well. But the piriformis is a stabilizing muscle. So usually those are overactive because the glute strength isn't there to help stabilize those hips. So think about strengthening that posterior chain, that lateral hip. And if you have any questions, Deborah, you can more than welcome to message me, and I'll be putting mobility wall and my contact information on here afterwards as well. For Kyle, I think it was Kyle that said it. For the shins, I like to, if I'm trying to get like my peroneals, like if you're having shin splints, I like my setup to be starting off like mid thigh. That way I can cross my leg. And now the outside portion of my shin, outside and slightly anterior or front, is on here. And I'm just providing that inward, and it's a little bit downward actually for this version. It's kind of hard to do an up, or at least I haven't found out. Chris, if you found a way to do an upward pressure for the shin splints, feel free to walk me through it. But this is how I usually get my shins and my peroneal muscle group. Is I'm here. I guess I'll can put myself a little bit closer. I'm here and I'm kind of just sinking down into it. The great thing is you have your door frame to kind of just hang out and just lean into it. Again, take to whatever you can control and tolerate. But from here, I like to scan. So your peroneals or your fibular muscles runs from kind of right underneath and the outside of your knee all the way down to your ankles. So I'll scan from ankles all the way to the outside aspect of my knee. And I'm just kind of just sinking into it. And then you can do some ART since this foot it's not a closed chain. It's not stable anywhere. You can plantar flex. So for me, this is tight. And Kyle, I don't know if you have a mobility wall and you're following along with this, but as you bring your toes away from your knee, you're gonna get that stretch of your peroneal muscle, and you're just tacking and gliding, and you're just going back and forth. And then I'll scan again, find another spot. This one's a little tight for me, a little tender. I'll do the same thing. Do some ART, some active release techniques. Go into some plantar flexion, and then releasing. Does that help a little bit, Kyle? I think it was you that sent that that comment. Yeah, the Pro Series, awesome. Pro Series, it's awesome. It's a definitely a game changer. You can honestly, I haven't used it, but since you have the Pro Series, you could probably get this as well. Attach it. I would probably use a small ball for this one, Kyle, since you have the Pro Series. And then now this is gonna be a little bit more aggressive, but now at least you can be more pinpoint specific. You can find that tender spot. You can still scan. And for those that don't have the Pro Series, I basically just took one of the attachments, placed it on here. But Kyle, like you said, you can just scan, find that tender spot, and then yep, definitely. Okay, yep, the ART is definitely more effective if you use the attachment. Hopefully that helps out a lot too, since you have the Pro Series. You can do some ankle cars or some ankle circles too with this, and it really gets those peroneals released. Does that help out a little bit, Kyle? Deborah, 50 years of dental hygienist. Yep. So that's sitting down or even just those positions too. Uh, so you have a sciatic issue as well. Yeah, I definitely agree with Kyle. With the sciatica, you don't want to irritate that sciatic nerve. Um, Stretches will help, but the long term, and this is what I always educate my clients, is the strengthening and mobility is what's going to help out a lot, because we're always trying to find the root cause of the sciatica pain, and whether it's lack of mobility or lack of strength. All right. But Deborah, if you're still working as a dental hygienist, I mean, before I started my own business, I know some other clinics that brought the mobility wall to their office. So that could be something to consider as well. Cars and FRC, exactly. All right. How are we on time? It is 11 o'clock. I had a couple things I want to show, but I hope this was all informative and effective uh, for you all as an educational platform. Thank you for everyone that tuned in, whether you came from, was it Dallas, Florida? There was one in Philly, I think. One in Philly. Thank you all for tuning in. Any last minute questions before we add? Chris, if you want to add your guys' social media, you're welcome. Tim, of course, of course. Chris, if you want to add your social media platforms on the chat as well. They're always posting ways to release some soft tissue. I might be posting some demos on my platform as well, using a mobility wall. So you can share that. Anything else I'm missing here, Chris, as we wrap things up? So that's their Facebook link on the chat. If you guys also, like I said, I'm a doctor of physical therapy. So I do physical therapy out here in San Diego, and I do online programming as well. And I'm posting things on social media. Hopefully, get some mobility wall content on there as well. So, along with mobility wall, you can also follow me on my platform. This is for Instagram. So it's Aaron.performance PT. So I'm based out here in San Diego. I do in-person and virtual visits. I am offering some complimentary consultations. So for those that had like IT band pain, shin splint, sciatica from the chat, feel free to message me and we can walk through some things. And I know we're just talking over chat in a public chat here, so we can really break that down a little bit more. Let's see. Oh, and the giveaway. Is the giveaway? Should we do that right now, Chris? And for Chris, if he has anything else to add, we'll do the giveaway. So the travel bag giveaway was going to be given to someone who was active in the chat and active throughout the stream. So I feel like I was Kyle, if you can contact Chris. I appreciate you being active in the chat and active throughout the stream and just continuously asking questions. Chris, I don't know how you want to go about that. If you just want to direct message Kyle. But Kyle, congrats on the giveaway. And I think that'll wrap it up for today. Feel free to check out their website. They have a lot of good products and a lot of products coming in as well. But I did use the Mobility Pro series here. You can use a smooth one as well. They come with 4 attachments for the Pro and the 1 single ball attachment for the I don't know if what's the name for it, but the smooth foam, the smooth foam one. All right. You may give it to Deborah. Kyle, thank you so much for doing that. That's very kind of you. So Chris, please contact Deborah for the travel bag giveaway. All right. Thank you, Kyle. Thank you for everyone that tuned in. Deborah, Tim, Vito. Thank you all for tuning in. All right. And I'll email me. Very generous of you, Kyle. All right. I think that's it. So we'll end stream here unless anyone has any further questions. Feel free to give a follow at Mobility Wall on Chris's social media and on my social media as well. All right. Have a good one. Stay safe, stay healthy, and I'll talk to you all soon.